Vitamin D is made in the skin primarily when cholesterol is converted into vitamin D after exposure to sunlight, although it can also be gotten from dietary sources. And vitamin D binds to a receptor inside cells, and the two migrate to the nucleus where they bind to DNA and turn on genes. There are perhaps 200 genes which are activated after vitamin D and its receptor bind there. And many of these genes have roles in the immune system, such as the limitation of the production of inflammatory signals and the regulation of the maturation of immune cells. Given these diverse roles, some have wondered whether vitamin D, while clearly not the cause of the coronavirus or a major factor, might nevertheless have some role in offering protection against coronavirus infections or their severity. There are a number of lines of reasoning and evidence which suggest that there might be a relationship between vitamin D and coronavirus infections, and that vitamin D could offer some protection. So, for example, populations of society which have shown a higher risk of coronavirus infection also have a greater susceptibility to vitamin D deficiency, whether this be with the elderly because of a decreased production of the precursor of vitamin D in the skin, or individuals with darker skin because the melanin blocks ultraviolet light from causing vitamin D synthesis in the skin. Vitamin D deficiency can increase risk of hypertension, diabetes, and heart disease, all of which are risk factors for coronavirus. Vitamin D decreases the production of pro-inflammatory local hormones or cytokines, and these are known to be in excess, causing a cytokine storm in coronavirus infection. Coronavirus infections have occurred at a high rate in the United States in winter, and these are countries which are farther from the equator. Countries closer to the equator, many have had much lesser rates of infection. Japan is also farther from the equator, but has a much lower rate of infection. Perhaps one of the factors might be the greater dietary source of vitamin D in the fish which is consumed there. Also, there have been some preliminary studies which have correlated patients of coronavirus who have lower levels of vitamin D as having a higher risk of a negative health outcome. So while coronavirus infection is complex, involving many factors, vitamin D does seem to have at least some role in offering protection from infection.